Hey, ladies and gentlemen, welcome to another edition of Health IQ. What's important is that we have trusted voices, members of our community that we can trust. We need to understand public health at a level that probably prior to the pandemic, we had no understanding, but it doesn't stop with the pandemic. There's an evolution of education that really needs to take place, and we've got great trusted voices. One, I'd like to introduce you all the way from Springfield, Mass. Commissioner Harris, how are you? And are you having a great day?
I am well, and the day is going well. We had a wonderful staff event earlier, so it's been a good day so far. So thank you.
Public health, if you had to give a quick speech to the community on the importance of health and having and understanding the role of a health department, could you share your vision?
Certainly. So for me, public health is a social justice movement rooted in science. And the science is the evidence-based strategies that we use in order to keep our communities healthy. So public health was really founded around the time in the 1800s when we were really concerned about people and their health and equity in health. And so this movement of public health is often very difficult to explain. So it is prevention, intervention, and treatment. Those are the three areas of public health. We are very responsible for so many things: the air, testing the water, our restaurants, making sure substance use disorders are taken care of, so many child maternal health, infant mortality. So when you think about public health, this social justice movement, it's clear that there are many parts of it that are really important to the public and having a healthier community.
Why did you tell us the story when you decided it hit you and you said, you know, this is for me and I can do it for my community?
I must tell you that there is nothing in my life that's planned. I am very much a person who believes very strongly in the fact that I was rooted at an early age in this social justice movement because of the era I grew up in. And so we grew up in an area of social activism. And social activism led me to work in a health center called Neighborhood Health Center, where everyone there was really immersed in health. And so I really became someone who studied those women who happened all to be from the African American community. So at a very early age, I got immersed with individuals who cared about the health, cared about the community. And so that is really how I started to think about myself, how I could have an impact on our community in the city of Springfield and beyond.
Talk about the changes. That seemed like a collective thought, but what have you seen over the last 10, 20, 30 years as our collective thinking about our health as a Black community?
You know, it's interesting, and I'm glad you asked that question. Over the years, there have really been changes as far as the health status indices are concerned. We are paying more attention to data and making sure that we are looking at positive health outcomes. I think early on, I experienced our movement as more reactive. Based on the issues that I was dealing with at the time, which was the HIV/AIDS epidemic, which really kind of got me into the mode of being able to want to do this work. But we didn't rely as much on data as we do now. So we have the tools, more tools, to be able to do this work. The other thing is, although we don't have enough people of color, African American, and Black individuals in our public health community, that is changing a bit. So the health status indices, many of them are still the same. Certainly nobody could have predicted a COVID-19 pandemic. And so the public health community was really thrown into this pandemic in a way that we were not experienced in how to handle. We had epidemiologists, we had our infectious disease individuals, and even they were not prepared for the pandemic that we are currently experiencing.
When you think of that, Commissioner Harris, and you think of what we also learned about pre-existing conditions in our community, what's the story about pre-existing conditions and our inability based on the inequities in healthcare that our community is impacted in a disproportionate impact as it relates to those pre-existing conditions, health conditions?
Well, that's an excellent question. Here where I live in the city of Springfield, if you look at the data for the Commonwealth of Massachusetts, the Black community, African American community are disproportionately represented in every one of those health status indices. And so we ask ourselves the question, why is that? And a lot of that has to do with the social determinants of health. So we're talking about nutrition, we're talking about housing, we're talking about employment, we're talking about mental and physical health. We have not had the same kind of attention and access that the white community has had as far as those areas our health is concerned. And I think one of the changes really is that we are looking at health more holistically. We're looking more at the environment. We're looking more at food. We're trying to do education, but it's still in every health status indices that I look at in the city of Springfield and in the Commonwealth, our Black community is disproportionately represented, and it has to do with a lot of the things that I just mentioned.
Well, thank you for that. The Commissioner Harris, in COVID-19 and just the whole idea that we now find ourselves in a pandemic, what should people be aware of given that there's so many signals going on right now? Mask, no mask, vaccination. What would be the priorities, or what we would say your COVID protocol that you would suggest the public still adhere to?
Well, it's important that we understand as a Black community, as a country, that this pandemic is not over. And so we are continuing to see cases, although not at the same level that we did. So the message is really for with individuals who have chronic diseases, individuals who are immune compromised, those individuals who are unvaccinated, are not boosted. It's important to educate our community around the safety of the vaccines. We look at the data and we know that individuals who are vaxxed and boosted, although they may wind up in the hospital or they may have symptoms, they are not dying at the same rate as individuals who are unvaccinated. So my message really is to listen to the trusted voices. Talk with your primary care physician, talk with your faith leader, talk with those individuals that you are comfortable, who you trust, to get sound advice. This pandemic, we have seen so much as far as this has really shown a light on health disparities, because what we know about this pandemic is that it is disproportionately impacting the Black community across this nation. And so my message really is, number one, this pandemic is not over. Number two, know your health status and take the necessary precautions. Number three, understand what risk management means. Understand your risk and how to manage it. It is really very important that, again, the masks are coming off, people are gathering more, being comfortable. This pandemic is not over, and we need to be able to help educate our community in a way that they can hear us, not in a way that's punitive, not in the way that's pointing fingers, not in the way that is helping people to feel uncomfortable. Our messages have to be clear, they have to be concise, and they have to speak to the experience of those individuals that we are trying to educate.
Thank you for that. Just thinking about the idea of a sister with superpowers like yourself, you've created a safe space in the health department with benefits for this entire community. What would you say to a graduating class at a Howard, a Spelman, a Morehouse about their future and how they too need to create safe spaces with benefits for their community in the
Uh,
health field?
I would say that it is critical, those individuals in the institutions, colleges that you named are thinking critically about giving back to their communities. One of the things that is challenging for me is that I'm seeing so many of our young people who are from HBCUs, who are across the country, who are leaving our communities and really not plowing back into the individuals that they grew up with, or the individuals who they are around as far as the community is concerned. So I think it's giving back to the community, number one, and understanding your value is number two, that you are of value wherever you decide to put down your stakes or your work. You are of value, give back to your community, and understand how important public health is to the work across this nation. And I always encourage people that I talk to about this social justice movement that I call Rooted in Science, is that giving back to the community, understanding your value, and just plowing into those people we care about. Also, our youth. I'm very concerned that we are not educating and influencing our youth in a way that have them see themselves in a future, creating that pipeline for our youth so that they understand their place and their value, their worth, and how they can give back and be successful.
Thank you. Lastly, for young sisters who are literally seeing leadership, yourself, Vice President Harris, what would you give them if you could be the whisperer in the ears of young sisters about imposter syndrome showing up, and if nothing else, the example that you are of Black and Shero excellence?
Well, you know, what I would say to young women is that it is a journey. It is not a sprint, it is a marathon. And again, understanding, young women, that you have power and purpose, and that there will be times that you are vulnerable. There will be times that you don't know the answer, and that's okay. It's okay not to be okay, if that makes sense. I think that as Black women, we operate under this excellence. We must be excellent in everything that we do. And we know that we represent our families, we represent our community, we are a foundation. So young women need to believe in themselves, believe in their power, believe in their value, believe in their ability to make a difference as far as their work is concerned. I think the other thing is to try and understand that there is power in your passion. Figure out what your passion is, put that power behind it, and really don't allow barriers to get in the way of your success. And then define for yourself what success is, and not society's definition of a successful you. And so I think that we have a lot of young women, Black young women out there who are doing amazing things. And I look at them and I am in awe. I am absolutely in awe of the things that they have accomplished and what they will accomplish. So I am very proud as far as our community is concerned and where we are headed. And I'm really looking forward to helping to guide those young women. And I have many of them who are around me in this department. It is amazing. And so I think we are on a path to success as far as particularly our young women are concerned.
Super. COVID has left us a little confused, dazed, and fogged. Mental health, isolation. What do you suggest we all do as it relates to being able to cope in this ever-changing environment?
Recognizing that mental health is critical. And I think that's probably one of the areas that we have not paid as much attention to as I think we should. Our children were home for a year or more. They were not having interactions, or we're not in social environments. And so our children's mental health were certainly affected. We watched our suicide rates go up amongst all of our population, but particularly young people. So COVID has really thrown us into this area. And I think that we are going to continue to see the effects of COVID-19 on our community, on our health, on our infrastructure for many years to come. This is not something that is going to not be with us in terms of the impact. So the impact of COVID-19. So what do? We recognize that there are mental, physical, social, and emotional health areas that we have to pay attention to. Parents, pay attention to your children. We are watching our children really just struggle academically, socially as well. So we are in for a long process as far as healing ourselves as far as COVID-19 is concerned. And I think it's going to be with us for some time.
Well, thank you so much for all of that. I appreciate it. I really appreciate you, Commissioner Harris, taking the time to speak with us here at Health IQ. Any last words for those who are looking to figure out how they can begin to exercise and kind of change the health condition they might have found as they added a few pounds, or some simple solutions to the sun now getting ready to come out and brighten the lives of us as we now have entered that new moment. So there's a longer day. I think that's, outside of love yourself and don't be ashamed of whatever state you find yourself in COVID.
One step at a time. So I think that we have to get out and exercise and be real active. Walking is wonderful, talking is wonderful, socializing is wonderful, really understanding what is it I need in order to make myself healthy. We believe that health, a totally healthy person, is physical, mental, social, and spiritual. So there are quadrants to our health besides the exercise. So I always tell individuals to look at all of the quadrants of your health to really be healthy and take care of all of them, one step at a time.
Perfect. Ladies and gentlemen, the fabulous and famous, all the way from Springfield, a trusted voice in our community, a sister with superpowers. Commissioner Harris, thank you so much for coming on Health IQ.
Thank you so much. I appreciate your having me on, and you have a great day. Take care.
Thank you.